Good morning, ladies and gentlemen. Good morning. Well, welcome back to session 5. This is our last session of the workshop, but it's going to be action-packed. We're going to start off with considerations about reflecting upon the business case for high-value CPD and how it might be operationalized by credentialing and accreditation organizations. And we will go until 9:15 and take a short break till 9:30, and then have the report backs from the breakout groups, which will be very exciting. And we'll start our last session at 10 o'clock with reflections and considerations for next steps. So in this brief time together this morning, we have quite a bit of things to accomplish. So to get us going, I want to remind everybody that we have webcast viewers, so say good morning to all our webcast viewers, and that we need to remember to press our mics so that they can hear what we're saying in the room. So I would like to bring up Malcolm Cox to introduce the next session, and he is our Global Forum co-chair along with Susan Scrimshaw. You've seen both of them in and out of this workshop as well, so come on up, Malcolm.
Thank you, Holly. I'm not quite sure why Patricia and the co-chairs of the workshop chose me for this particular assignment, but I'm delighted to do it because it gives me an opportunity to reflect on accreditation. Now, you all have at your places one of the recent workshop publications on accreditation. And so the question becomes, why is a person walking a tightrope? Why was that chosen as the logo for the book? This is I'm not going to have a whole discussion about the choosing of this, but I ask you to reflect on that because to my mind, and I just thought of this morning, it really reflects the sort of schizophrenic issue that accreditors have. I mean, on the one hand, they're responsible for the health of the public. On the other hand, since the profession has been delegated the responsibility for maintaining quality, they have a responsibility to the profession. So it's sort of an interesting tightrope and schizophrenic sort of attitude, which I thought it would be worth reflecting on. Anyway, this accreditation session interestingly follows the publication of the accreditation workshop. So we are here today at 8 a.m. to talk about the business case for accrediting and credentialing bodies to move forward with high-value CPD strategies or tactics, or as I call it, moving from pharmaceutical support to high-value CPD. I well remember 45, 50 years ago when I started in this, that this was really accreditation was embedded and not accreditation, but CPD was embedded in pharmaceutical support. Unfortunately, we've come a long way from that to a much different circumstance. CPD is evolving even further when you think about it, because they're now very much results or outcome oriented. And this is true for all the accreditation bodies. They may be at different stages of evolution on that journey, which is also actually discussed in this old workshop that you might want to reflect on your plane or train as you go home. But they really are in the forefront now of pushing, pulling, and dragging, in many cases, the profession forward into thinking about results or outcomes-oriented or competency-based, as opposed to the old counting the number of hours you spent in something. So this is really, I think, an incredibly important topic, which is why it has its own particular session, I think. So we're very happy to have with us today 4 distinguished panelists, and I'm not going to go through their bios other than their names and the organizations that they represent when they're not here at a conference. Neil Harvison, American Occupational Therapy Association. Kathy Chappell, Accreditation Program and Institute for Credentialing Research, American Nurses Credentialing Center. David Benton, the National Council of State Boards of Nursing, and Kate Renier, the Accreditation Council for Continuing Medical Education. So we're delighted to have these people with us because they're going to give us a perspective on some of the new work and new directions that the accrediting bodies that they represent or that they work with are doing to move things in a much more high-value CPD direction. So I'm going to ask the four of them to come up to the table here. I'm going to join them at the table, and we're going to work from there for everyone's convenience rather than standing at the forum. So we have 5, 6, or 7 minutes assigned, I think is correct. Holly, is that right? To each for some remarks, and then we're going to move on from there for an open discussion. So I'm going to join my distinguished panelists over here. I'll take this with me.